Hi, I'm Jackie Warden, Advanced Nurse Practitioner in the Oncology Department at the Churchill Hospital. This is a patient information video about enzalutamide, a medication commonly prescribed for gentlemen with prostate cancer. In this video, we will cover what happens when you are first prescribed enzalutamide, what happens on an ongoing basis in terms of clinic reviews and bloods monitoring, how you will get hold of subsequent supplies of enzalutamide, who you should contact if you're unwell, and finally, the clinical nurse specialist team who will be ongoing support for you throughout your treatment and beyond. I hope you find this information useful. So you've seen the medical team in clinic and decided that enzalutamide is the right treatment for your prostate cancer. You will have signed a consent form and been given some patient information leaflets about the treatment itself. It's likely that your consultant or medical team would have asked you to have a further blood test taken so that we can make sure that you are fit to start the enzalutamide and also for a comparison with future blood tests. Your medical team will then prescribe the enzalutamide and let our pharmacy department know. Our specialist cancer pharmacists will then carry out a number of safety checks. This makes sure that the drug is the right drug for you, that the dose is correct, and that the enzalutamide doesn't interact with any other medication that you are already taking. They will also double check the blood results that you've had taken. Once they're satisfied that the prescription is right, they will then send that to an external company who will contact you to arrange delivery of the enzalutamide. It's a good idea to read the information that you've been given by your consultant and also watch the whole of this video before starting to take your treatment.
Hi, I'm John. I'm an oncology pharmacist. I can prescribe enzalutamide, and I'll be talking to you and other patients in clinic about enzalutamide and how it's going with your treatment. We will discuss any issues that you may be experiencing when you're taking the enzalutamide tablets. These can include hot flushes, they can include fatigue, sometimes your energy levels might be affected. And we'll also be asking about whether you have any effects on memory or cognitive concentration. And we'll also be asking you about bone health and whether you could be or should be taking calcium and vitamin D to protect your bones. We will have ideas around how we can help minimize those symptoms or toxicities. One other thing that we like to check, especially at the start of enzalutamide, is we ask people to check their blood pressure regularly. We could consider a dose reduction, which may help to alleviate things like fatigue and maybe reduce some of the hot flushes. When we speak to you in clinic, we will check your blood test and check particularly PSA, which is an important marker in prostate cancer. And we'll also be checking other markers, including testosterone. We'll be aiming to see you in clinic probably every 3 months when you start enzalutamide, and if you are responding and are doing well on treatment, we may well see you every 6 months.
Hello, my name's Chandra. I am one of the pharmacy technicians working in the cancer team. Just wanted to talk to you about your medication, what you will be expecting. We have a delivery company that will be delivering your medication to you. When you receive your delivery, open it up, take a look at what's been sent to you. Hopefully you'll have 3 separate boxes, one for each month. Each box represents a cycle, and so that will be 3 cycles worth that you would have received. Please have a look at the label on the boxes, make sure it's got your name on it, and make sure it is the dose that you are expecting to take. It can be 4 tablets, or it can be less tablets that you take. When you take them all at once, so that is your 1 dose. Doesn't matter what time of day, but make sure you stick to that time, or roughly that time every day. It doesn't have to be with food, can be without. If you miss a dose, and it's still within the same day, just a few hours later, just, take your tablets. But if it's sort of like night time now and you're going to be taking a dose in about 6 hours time or so, just miss that dose. Likewise, if you've run out of tablets and we've not managed to get your tablets to you before you've run out, it's actually okay to go a few days without having these tablets. If for any reason you do vomit, don't take your dose again. Just forget about that dose for the day. Please make sure that you store your tablets somewhere safe, far away from little children, or usually in a cool place, please. I would suggest that you actually gave us a call when you've got about 2 weeks of tablets left, so that we can start chasing your new prescription up with the doctors and get that sent to the delivery company. It's a voicemail message service. You just leave your name and your date of birth and your NHS number if you have it, and your telephone number, and then we will get back to you. But once you're established on treatment, you will hopefully get into a pattern of going to your GP or to the hospital and get your blood test done, and aim to do that every 3 months, so that we've always got an up-to-date PSA for you. We will look at your blood results, we will monitor your PSA, we will give you a call just to let you know what your results were, and to just check to make sure that you're okay and there's no worsening of any symptoms.
Hello, my name's Hannah. I'm the lead nurse for the Oncology and Haematology Triage Unit here at the Churchill Hospital. We're a small nurse-led team, and you will be given our information and contact details following your clinical nurse specialist appointment when you begin your treatment. As part of that, the information that you'll be given is to call our triage line if you develop a temperature of 37.5 or above, or if you develop any symptoms that are concerning. When you call our telephone line, we will ask you for your NHS or MRN number, which is very helpful if you can have that available to us. We will then go through a series of questions with you to understand your issue better and to understand how we'll best be able to help you. The Oncology Triage Unit is open 24 hours a day, 365 days of the year. So we encourage you to call day or night, anytime your call will be answered. The triage assessment area is open from 8 AM in the morning until 10 PM at night, at which point, if you require to stay, then you'd be transferred to an inpatient bed at the Churchill site. As a result of your assessment over the phone, we may decide that the best course of action is to temporarily stop your treatment until we can liaise with the medical team.
Hi, my name's Louise. I'm one of the uro-oncology specialist nurses at the Churchill. I'm part of a small team that look after the uro-oncology patients. You might have met myself or one of my colleagues in clinic. We are here to support you and your family throughout your treatment pathway. If you need any advice or any support, please contact us. If you haven't met myself or one of the team, you'll be able to meet one of us at a future clinic appointment. Feel free to contact us at any time. Look forward to meeting you.
I hope you found that information useful. This video is not designed to replace support from the hospital team, so please do get in touch if you require our support.